We move on to the abdomen. We look for the present size and situs of the stomach, meaning whether it's on the left or the right. We look at the kidneys, the bladder, the umbilical cord insertion site into the fetal abdomen, and the umbilical cord vessel number. So here we have the stomach on the left and the spine is over here, and you have to know the position of the baby, that this is in a cephalic position with the spine to the left and the left side down. These are the kidneys, and in order to identify the kidneys, we need to see a little bit of Gerota's fascia here, or a little bit of the pelvis, and there's a little bit of the pelvis in order to say that we are certain that there are kidneys there. And there's a nice bladder, fluid-filled collection in the pelvis. At 10 weeks, we can see some bowel that herniates out into the cord. This is normal physiologic herniation. It should be back into the fetal abdomen by the end of the 11th week. So here you can see in the same fetus at 12 weeks, it's back inside the abdomen. So that is normal. A normal cord insertion later on in the second trimester, we should see fluid on both sides of the umbilical cord. When we go down to look at the vessels in the cord, we usually take this picture, which is a color picture using power Doppler, showing the two hypogastric arteries alongside the bladder as they enter into the fetus, and that tells us that there is a 3-vessel cord with 2 arteries. Now, the iliac arteries are similar to the hypogastric arteries, and so it is important to make sure that you know where the vessels are coming in. These would be the iliacs, whereas these would be our umbilical arteries coming in. Now, the umbilical cord can also be identified within the amniotic fluid, and you can see those 2 arteries and 2 veins in both of those pictures. We talk about them as the Mickey Mouse ears. We need to also look at the spine, looking at the cervical, thoracic, lumbar, and sacral spine, and the extremities, the legs and the arms. Now, when we look at the spine, we need to not only look in longitudinal, where you see the picture in the upper left where it looks like a zipper, and you can see all of those vertebral bodies paired. As you look at, these are paired as you go along, so that if they're abnormal, you would see it. The thoracic spine, we need to look at the entire spine in transverse at all, where we count 1, 2, 3, coming down 1, 2, 3, and then to the sacrum once again, and we also look at the skin on top to make sure we don't have any spinal defects. The upper extremity, we're supposed to look at those extremities, so we take a picture showing the humerus and the radius and ulna with the hand below. And we don't take open hands on everyone, but we do try to in some patients who are at increased risk. The lower extremity, we take pictures of the lower leg and of the ankle. We need to take pictures of the gender in multiple gestations, but in singletons, it's not necessary in the low-risk pregnancies, but most of our families in our culture would like to know the gender, and they feel much better if you can tell it to them. So I'd say about 80% of patients want to know their gender, and it'll all depend upon your patient population. This is a male with the 2 legs spread, and you can see the scrotum and the penis right in the middle. Now, the guidelines also tell us that we need to record a permanent record of our images. And we need to record the measurements so that when we take that picture that comes up on the computer, we need to actually print it out some way. It's also important to label the images with the exam date, the patient ID number, and if appropriate, the image orientation. For example, whether it's sagittal or transverse, and also whether it's right or left-sided. Since the fetus moves around, you don't really know if it's an abnormal right kidney. We'd like to know that, and that there needs to be a written report. The equipment that we're supposed to use, the guidelines tell us that we can use real-time scanners, transabdominal or transvaginal, that the transducer should be using the appropriate frequency for whatever you're trying to look at. That real-time sonography is necessary to confirm fetal life through observations of fetal cardiac activity and active movement. Now, for fetal safety, ultrasound is considered to be safe, but we should only perform it when there's a valid medical indication. And that's because we want to use the lowest possible ultrasound exposure settings when we can, to use the same principle, the ALARA principle that we use for radiation, which is as low as reasonably achievable. Now, ultrasound does have bioeffects, and the bioeffects are predominantly related to thermal effects and mechanical effects. The energy levels depend on the machine settings that you use. The MI, which is the mechanical index, and the TI, which is the thermal index, are both listed on our images. Now, some images will only have the mechanical index on them, and some of them will only have the thermal index on them. But both of these we want to try to keep below 1.0 if we can. Now, when we turn on color, we will always increase those indices a little bit, particularly the thermal index, and we want to use color very briefly when we turn it on. Now, the bioeffects studies that have been done with ultrasound are all done based on old limits of 94 milliwatts per centimeter squared. But as the technology has developed, we now have much higher limits, and we use 720 milliwatts per centimeter squared, but all of the bioeffects studies have not been repeated, because basically in our culture, greater than 80% of women get ultrasound exams, and we can't really do those same studies that were done early on. So the main point for you is that you don't sit and scan a fetus forever. You mainly try to get in, look at what you need to look at, and then get out. Because raising the temperature in the fluid around the baby is not healthy for it, and we don't want to do it for prolonged periods of time. The AIUM tells us that the promotion, selling, or leasing of ultrasound equipment for making keepsake fetal videos is considered by the FDA to be an unapproved use of a medical device in the United States. Use of a diagnostic ultrasound system for these purposes without a physician's order may be in violation of state law or regulations. Policies and procedures related to quality, patient education, infection control, safety, and equipment performance monitoring are all a part of those guidelines, and they must be developed and implemented according to the AIUM guidelines. So there are additional guidelines telling us how to sterilize our transvaginal probe, for example, and about safety beyond what we've gone over today. That's the end, and thank you very much.